Let's jump right in. Welcome to The Explainer. We've all stared at an ECG and just seen this maze of squiggly lines, right? To the untrained eye, it looks like total chaotic noise. But what if I told you it's actually a super precise 3D map? Today, we're going to take those abstract squiggles and transform them into this totally intuitive, three-dimensional spatial framework.
Okay, let's dive into this. Honestly, the absolute best way to really get an ECG is to flip how you fundamentally think about it. The source material hits the nail on the head here, saying ECG leads act as camera angles that look at the same electrical events from different spatial orientations. So just picture the heart as the star of a photo shoot, right? The leads of the cameras, they're all snapping a pic of the exact same moment, a heartbeat. But since they're set up in completely different physical spots, their photos look totally different.
So here's our game plan for the explainer today. First, we'll look at the camera angles of the heart. Second, mapping the anatomical planes. Third, and this is the really crucial part, recording the electrical impulse. And finally, pinpointing cardiac pathology. All right, section 1, camera angles of the heart, setting up the studio. Now, capturing a complex 3D object like the human heart, we need a lot of perspectives for that. And that's exactly where the standard 12-lead ECG comes in. It gives us this really comprehensive 3D view of both atrial and ventricular depolarization and repolarization. Think about the challenge here for a second. The heart is 3D, but the readout we're ultimately holding is a flat 2D piece of paper. We literally need all 12 of these distinct camera angles working together so we can reconstruct that full volumetric picture in our heads. Moving on to section 2, mapping the anatomical planes, placing the cameras. So where are we actually putting these 12 lenses to get that 3D view? Well, we split the standard leads into 2 distinct groups based on the anatomical plane they monitor. On one side, you've got the limb, or extremity leads. That's I, 2, 3, AVR, AVL, and AVF. They record electrical potentials on the frontal plane, basically looking at the heart from the front, top, and bottom. On the flip side, we have the chest or precordial leads, V1 through V6. These guys look at the horizontal plane, giving us a cross-sectional view, almost like we slice the heart right down the middle. Let's stick with that frontal plane for just a sec. We use a hexaxial diagram to track the electricity here, and the normal QRS axis ranges from -30 degrees to +100 degrees. That number is our anchor. It essentially tells us the average overarching direction the electricity is flowing during a normal, healthy beat. If the axis falls outside that specific range, well, boom, we instantly know the current is going somewhere it definitely shouldn't be. And to measure that axis, we look at the specific angular positions of those frontal plane leads. It's all measured relative to the positive pole of lead I, which sits exactly at 0 degrees on our geometric map. From there, lead 2 sits perfectly at +60 degrees, and lead ABF points straight down from the bottom at +90 degrees. It's a ridiculously precise mapping system, literally no guesswork involved about where our cameras are set up. Okay, switching gears to the horizontal plane across the patient's chest, we step through leads V1 to V6. V1 and V2 are our right precordial leads, right up close monitoring the right ventricle. Move around the side, and V5 and V6 are the left precordial leads. And this is kind of the coolest part. In a healthy heart, as you pan your camera from V1 over to V6, you get a normal R-wave progression. The R-wave amplitude smoothly increases, and the S-wave amplitude drops off. It is this beautifully predictable geometric pattern of electrical flow right across the chest. All right, into the main event, section 3, recording the electrical impulse, taking the picture. This right here is the absolute core focus of our explainer today. How exactly do these camera angles actually record the invisible force of electricity? It all comes down to the physics of lead polarity. Lead polarity dictates how the physical look of the ECG waveform is determined by the direction of the electrical impulse relative to the lead's positive pole. Remember, the ECG isn't just saying, hey, there's electricity present. It's telling us exactly which direction that electricity is traveling. That relationship between the energy's path and your camera's lens is what actually draws the lines on the paper. So, there are 3 definitive ways leads record that electrical activity. If the impulse travels toward the positive pole, the resulting deflection is positive. If it travels away from the positive pole, it's a negative deflection. And if the energy moves at a right angle to the axis, you get a biphasic wave. Let's really unpack these 3 scenarios, because this is where everything just clicks. First up, the positive deflection. This happens when the wave of depolarization spreads directly toward the positive pole of the lead. Picture this. You're holding a camera and a bright spotlight is shining directly at you, rushing right into your lens. The energy is coming straight for you, so the ECG machine records that incoming surge as an upright, positive wave. And the more directly the energy rushes toward that specific camera, the taller that wave gets on your readout. On the flip side, we have the negative deflection. This kicks in when the wave of depolarization spreads away from the positive pole. Imagine that exact same spotlight just turns around and speeds off into the distance, running away from your camera. The machine records a negative value and the line dips downwards. This is honestly why the exact same heartbeat can look like a towering mountain in one lead and a massive canyon in another. It's all about whether the electricity is charging toward the camera or retreating from it. And finally, the biphasic deflection. You get this when the mean orientation of the depolarization vector moves at a right angle to the lead axis. So the spotlight isn't running at you or away from you, it's running straight past you, crossing your field of vision from left to right. As it gets closer to your peripheral vision, it registers as slightly positive. But the second it passes you and starts moving away, it flips to negative. The machine literally draws a wave that spikes up and then immediately dives down. Which brings us to Section 4, pinpointing cardiac pathology, reviewing the film. Let's take all this cool geometry and bring it back to real-world, life-and-death clinical stakes. Because we know exactly where each camera is looking, we can use these specific angles to hunt down localized pathology. Say a patient has inferior wall ischemia, meaning the bottom of the heart isn't getting enough oxygen. We're going to see changes like ST segment elevation, specifically in leads I, 3, and AVF. Why? Because those are the 3 exact cameras assigned to look at the bottom of the heart. Same thing for anterior ischemia. Damage to the front of the heart uniquely shows up in precordial leads V1 through V6, plus leads I and AVL. But look, sometimes the standard 12 cameras just don't cut it. We have blind spots. So when we suspect hidden damage, we just bring in supplemental leads. We can use right-sided leads, literally moving cameras to the right side of the chest to catch right ventricular ischemia. Or if we're chasing an acute posterolateral infarction that's hiding in the shadows, we slap posterior leads right on the patient's back. We basically just keep adding cameras to our studio until we capture the exact pathology we're looking for. So as we wrap up this explainer, I want to leave you with this one thought. The next time you glance at an ECG waveform, don't just see a squiggly line. Ask yourself, which angle is this camera shooting from? Is the electricity sprinting towards me or running away? Once you stop seeing the ECG as this intimidating medical graph and start seeing it as a brilliant piece of 3D spatial geometry, the heart's electrical system suddenly makes complete, intuitive sense. Thanks for hanging out with me for this explainer, and keep exploring.